This is our 126th briefing, the National Emergency Response Committee on Coronavirus. The COVID-19 figures are on a steady rise, and that is likely to be so for a while. However, we have observed, after going through our data, including the data that we will share with you today on mortalities, that we are witnessing majority of the deaths in patients who have underlying issues such as diabetes, hypertension, and HIV/AIDS, amongst others. And we want to address the issue of HIV/AIDS today and its correlation to COVID-19. In Kenya today, out of all the HIV positive people who have been confirmed to be positive, 96% of them are on life-saving treatment. And more than 90% of those on treatment have controlled the HIV virus, therefore posing very low risk of transmission for HIV. We have further evidence that there is a decrease in the new HIV infections in the country to a mark of about 36,000 in 2018, which is really a stark reduction from our 2012 figures that stood at 100,000. And this is notable and remarkable. And indeed, Kenya is on its way when it comes to achieving epidemic control. And currently, in Kenya, we have 1.1 million people who are benefiting from antiretroviral treatment. Again, a remarkable achievement and a testimony to the strength and the resilience of our HIV program. And this progress can be attributed to many factors, amongst them, primarily, an excellent partnership with bilateral and multilateral agencies, the use of a multisectoral response, and a strong health sector leadership and strong political commitment, all of which have contributed to this success. However, as we celebrate this success, we need to be aware that COVID-19 poses a challenge to the uptake of HIV testing services, particularly due to the low outpatient hospital visits during this period. Yesterday, we articulated that we've seen a drop in outpatient visits by about 30%. And what this means is that majority of our people are no longer visiting health facilities for HIV testing services, and therefore there's a decline in knowing the true status when it comes to HIV. The lowest uptake was particularly noted in the month of March and April, where we had testing volumes reduced by up to 33%. On the other hand, we also note that community testing has also reduced by 71% when it comes to HIV care. We have noted that HIV pregnant mothers do continue to attend their ANC clinics, and there's been a slight impact of COVID-19 to this statistic. And so it becomes important really today to focus on this condition, noting the gains made in the country, but emphasizing that we do need to pay attention to ensure that we don't lose on the results that we've gained. Ladies and gentlemen, we have an upward trend in the number of clients newly enrolled in antiretroviral therapy between January to July. However, even as we enroll these clients, again, due to COVID, there is a problem when it comes to these clients being able to get their ARV treatment. And we've seen a decline, again, when it comes to refills for these medications.